Hello, everyone, and welcome back to another episode of the Concussion Nerds podcast. And today we are joined by another of our amazing summit speakers, Dr. Becca Timko. Becca, welcome to the podcast.
Thank you.
So excited to have you here. So before I dive into the awesomeness of who Becca is and what we're going to talk about today, if you haven't got your virtual summit ticket yet, jump over and snag it. We are going live and pre-recorded September 27th and 28th. There are free and VIP tickets. You get to hear from amazing experts in the space, one of which being Becca. And we're going to talk about chronic pain because so often there is this overlap between chronic pain and persistent concussion symptoms. And having the lens to be able to kind of step back and look at some of our clients through this piece, or if you're on this journey, understanding some of the chronic pain literature, you guys, it is a straight up parallel to persistent concussion. Really, it is. So come join us. Again, links are below. You won't regret it. If you are a VIP participant, and by VIP, I mean the prices are low. If you're an American, they're in Canadian dollars, so they're even lower than what you see on your screen. You get lifetime access to all the content. So, Becca, I'm so excited you were here. Y'all, the first time I met Becca, she was still in chiropractic school. Like,
we go way back.
Becca was one of the founding concussion nerds. She was one of, again, in chiropractic school, so eager and just also, I don't know how you do chiropractic school and extra stuff, but she did it. She showed up in Nerds. She asked the questions. She graduated school. And then, and I know this wasn't the plan, y'all, she opened her own clinic. That's a huge leap as a new grad, Becca.
Yeah, it's been a journey.
So I'm curious on two things. One, you've had a love of this space from the day I met you. So where does that passion for working with persistent concussion and chronic illness come from for you?
So I've been in the space of functional neurology since I was in high school. And when I was 16, I was introduced to the profession as a whole. And I was so curious about the brain. I was always that kid that was like, why, right? And functional neurology was the first piece that I actually felt like explained why. Like these eye movements, these vestibular findings can really explain all these symptoms that were always like, what do we do with these? I don't know, with that kind of thing. And so I saw when I was shadowing these docs growing up, these incredible stories that people would describe as miracles or magic, right? But then we would, break all these things down with the doc I was shadowing and draw out the pathways and be like, no, this is not magic. We can explain every single piece of this with neuroscience. And I was hooked. I love that, right? We can break it down to the nitty gritty. We can get really technical, but then we can also look at it from a 10,000 foot view and still take into account the human aspect of it, the emotional impact of all these different neurological conditions, and just love that piece of it. So I tried a bunch of other things like research, and I was pre-med for a minute, and I tried all these things, and I kept coming back to functional neurology because you could spend more time with your patients. You could take into account these more holistic factors and really get to dive in and dig deep and not just spend, 15, 30 minutes with your patients while still using research, which I also tried for a minute and decided lab rats were not for me. I really missed working with real patients. And the honest, most cool thing about my job, I just was telling a patient earlier today, how quickly we can see these changes, right? I'm sure you see them in your office too. We see these things change in real time. We test, we retest, we see those instantaneous changes. And that's the coolest part of my job.
I love it. And so because I don't know many people who are like, hey, I'm going to graduate school and now I'm going to start a business right away. But that's kind of what happened when you opened Clarity Brain and Body Clinic. And you guys, for those listening, Becca's clinic is in the Washington, D.C. area. She can say her. She tried to tell me what it was, and I was like, I can't pronounce that city.
The Canadian. I'm located in Bethesda, Maryland. So that's right outside of Washington, D.C. I serve a lot of different patients in the whole DMV area.
Okay. How did Clarity come to be?
Clarity Brain and Body Clinic is my baby, my biggest joy, my biggest passion project I've ever embarked on, and the most rewarding experience I've ever had in my life. And it came from this passion, right? I love functional neurology and I loved working with these patients, but I wasn't seeing the experience that I wanted these patients to have, right? I didn't have the control. I didn't get to decide what it looked like from start to finish. I didn't get to run late with my patients and really sit there and dig in if we were in the middle of something, right? I didn't want to cut them off and have to go see the next patient, right? I didn't want to hear the timer in the other room. And I wanted to spend an hour plus with my patients and really make that experience exactly what I wanted it to be, because I knew how magical and amazing neurology could be. I just wanted to do it my way. And so that was the coolest thing that I got to do, is I get to control the patient experience and do exactly what I want to do with my patients. And it works. The stories I have seen so far in my clinic have been amazing. They light me up every single day. I love coming into work. It's just the most amazing thing to especially help women, because that's what I'm really passionate about, helping women who have kind of been dismissed or kicked around in the medical system really get answers to their symptoms. And so that's been the most rewarding part, is in seeing those happy tears and the, oh my gosh, the light bulbs go on, right? I finally understand what's going on, and then we can fix it.
I need to give you some credit, but like the fact that one of the reasons you started Clarity was so that you could create a client experience to be proud of, that you've clearly given thought to, that you wanted someone to have. The amount of people, Becca, that don't think about things that far, and that client experience and that rapport and that overall experience that you provide is so important in creating safety and trust. And people don't give, I mean, you hear me harp on this all the time, people don't give that enough thought about how that in itself impacts the client's ability to heal and integrate the treatment you do. And so the fact that I didn't realize that was one of the reasons why Clarity came to be. And so like huge props to you for recognizing like, yeah, I could go into someone else's clinic and I could do the job, but I couldn't create the experience I wanted. And that experience in itself can contribute to the outcomes as well. Is huge, girl. Like, congrats. Like, there's not a lot of, especially like you're young. I'm old, you're young. And there's not, especially like, there's just not a lot of people that know to take that step. And that's huge. Like, congratulations on all of it. But like,
thank you so much. It's been so rewarding to actually curate that experience and see the difference, right? Because I've done similar exercises in different clinics or with different, patients, and it's so much more effective when patients trust you, when they know why they're doing things, right? When we take the time to explain the neuroscience behind it. If we want, we can draw out the pathways. Like, I love doing that too, pull out the pictures and all these things. Like, when they understand why, like, we're always harping on like non-compliance, right? Why aren't my patients doing my exercises? Why aren't they doing what I tell them to do?
They don't understand.
Let's make it a little bit more collaborative, right? It's not me telling you to do something. It's me explaining maybe the neuroscience behind it or why it's important to your case. And then we're going to work on it together, and you're going to want to do it because you're going to see the difference right away. And you're going to want to keep doing it because it's making you better, not worse or flaring your symptoms or all that kind of stuff.
I remember we have this one client. I'm a data geek. Like, I love data. And she has an Aura ring. So like, it'll track her heart rate, right? And she will looks at the trend data. And she, like, every time she walks in our clinic door and she'll look after, and her heart rate just like settles. And I'm like, well, if that doesn't speak,
the data doesn't lie.
Right? That's awesome.
Yeah.
So let's give a chat about like when I asked you to be part of the summit, and I said, what do you want to talk about in relation to persistent concussion? Like, what's something you're passionate about? You wanted to hit on chronic pain. And so tell me why, because I love it. I worked in the chronic pain space before the persistent concussion space, so I really love it. But it's also not a topic that a lot of people would think of right away when they think of persistent concussion. So tell me why this topic?
Yeah, it came at such a fun, interesting time too, because you were like, what are you passionate about? Like, what do you want to speak about? I was like, chronic pain. Like, it has to be chronic pain, because I was seeing so many patients at the time, and I still am, that had all these other things, right? I treat a lot of POTS, I treat a lot of dysautonomia, I treat a lot of post-concussion and concussion type stuff. And all these patients were also coming in with chronic pain. And we were doing the concussion rehab, we were doing the dysautonomia rehab, and they were getting better. but they were still coming in with 6, 7, 8, 9, 10 out of 10 pain every single time. And nothing we were doing in eye movement space, the vestibular space, were really changing that all that much. And I felt like I was doing my patients a disservice, right? Okay, your eyes can move better. You don't feel nauseous in the car, but we're still missing this 10 out of 10 pain that's definitely impacting your quality of life and definitely impacting your prognosis with your concussion symptoms, right? It can be a limiting factor. And so that was my kind of aha moment of like, I got to do better at this, diving back into the literature, going back to everything that I've learned from my mentors and different, neuroscience programs and education that I've done, and really dug back into it and started to reintegrate those things into my practice that I knew how to do, right? But they just fall to the bottom of your list sometimes. Yeah. And then I started integrating them alongside all the other rehab that we were already doing, and the pain started to go away, right? The happy tears come when you have a patient that's been in 9 out of 10 pain for years and years, and you finally get them a few moments of relief, or you take that 9 out of 10 to a 6 out of 10, like that's huge. And then I was hooked. I was like, I have to do this with every single one of my patients because chronic pain is so common, right? It's in most of our patients. I treat a lot of chronically ill young women. So that also incorporates things like hypermobility, right? A lot of young women are hypermobile and have joint instability, which can predispose them to chronic pain, all things like concussions, right? And so when I was diving back into the literature, didn't realize how common it was, right? Intuitively, we kind of know it's really common in concussion. We see it in our patients every day, but it's about half of patients with concussion develop chronic pain afterwards. And so if we're doing all the rehab and we're not addressing the chronic pain, we're doing half of our patients, if not more, a huge disservice.
Well, when you pull up the literature, I don't know the number off the top of my head, but like chronic neck pain is like near the top of the list of like disabilities experienced by people in the United States. Like it's crazy. So let's just talk about acute pain versus chronic pain first.
Yeah.
And because obviously in the literature, it's like if pain persists longer than 3 months, it's chronic. But at what point do you look at what is acute versus chronic? So let's start with that. Like at what point when you're looking at your client, are you like, hey, this is an acute pain person versus this is a chronic pain person? Is it just time that gets you there? What else kind of gets you to that spot?
So I totally agree with your hesitations about that 3-month cutoff. I don't love that as far as definitions go for chronic pain. We all know what pain is, but you will see in the literature, the 3-month mark is usually what people say. Hey, if pain persists kind of past that 3-month mark, we're now into the chronic pain phase of things. But I like to make it a little bit less. I don't like putting a number on things, right? Because it's different for every patient. So I say it's when the tissue has fully healed, right? So if pain is persisting past that point of full tissue healing, that's when it's more chronic pain. But there's a couple more things that I also look for because it's not always that simple, unfortunately. So take like a concussion whiplash case, for example, because that's a lot of what I see is all of that chronic neck and upper back pain and the coat hanger pain we've been seeing kind of pop off on social media is a good way to kind of describe it. If our whiplash injuries are healed, we're no longer seeing, acute strain or sprain after an acute concussion. And it's been, a couple weeks to a couple months. And we can even give it up to 6 months, right? Some people heal faster or slower than others.
Especially with whiplash. And we're taking care of all the other neurological pieces of it that might be contributing to neck pain as well, right? That eye-neck connection I know is really important. And we've taken care of all of that and we're still having pain. That's something that would tip me off, but there's a couple other things I look for as well. So pain that's kind of spreading or moving without a necessarily good explanation, right? It wasn't that they went to the gym and worked out really hard. It wasn't that they bonked their head on something again. It's just kind of moving and spreading. And that's a sign that should tip you off that it's more of a brain problem, right, than that actual acute tissue issue, because there's no good explanation. A lot of the times I see the left leg today, and then for some reason now it's in my right leg, or like or the symptom actually changes. So now all of a sudden I have a stomach ache instead of knee pain.
Right. Or now it's light sensitivity. The light sensitivity is coming back even though the concussion light sensitivity had already gotten better.
Yeah.
or suddenly we're sound sensitive, or we're getting headaches again, or, that nausea is a big one.
Mhm.
All those IBS symptoms are huge. And so, yeah, those are signs that we should look a little deeper, dig a little bit more into the brain side of things.
And so
yeah, go for it.
let's pause for a second because we just kind of went down the themes too. So it's not just pain, right? Like you just heard Becca and I talk about stomach being upset, IBS symptoms, headaches, light sensitivity. It doesn't have to be pain, right? When it starts to be a brain-based somatic sensation, and like Becca said, it morphs, it shifts, and there's not a logical explanation as to why. Or the knee pain is actually getting better, but now there's something new. It's a big, so for those listening, you might be like, this kid, like, what? Or it's like, I'm good. And now there's this new symptom. And now there's this new symptom. So it doesn't have to be, we're using the term chronic pain. It doesn't have to be pain the way we think of pain.
That's such a good point. And that's something I talk about with all my patients because it can be such a validating conversation to have, right? We know it's called chronic pain. So we think that it's just pain. That's not just pain. It's this whole experience that the body is going through. And so we got light sensitivity, sound sensitivity, chronic fatigue, the shifting, moving pain. And we didn't even touch on the emotional experience that can cause, right?
Mm-hmm.
When we're always fearful of our pain and we are not sure where it's going to shift to or move to next or when it's going to pop up and rear its ugly head again, we live in this state of fight or flight, right? Where is that bear? We talk about the sympathetic nervous system being this bear that we're afraid of. It's kind of lurking in the background all the time. And that can be pain for a lot of people. And so that unpredictability is so tough for patients, but a lot of the pain neuroscience education that I do with my patients can be really helpful to kind of shift that mindset from we're being chased by a bear to how do we put you back in the driver's seat and help you manage your pain and think about it a little bit differently.
So like for the clinicians that are listening to this episode, say, because the treatment shifts. So what is a common thing you see in your clients with, let's go chronic neck pain?
Yeah.
What's the example you see over and over again in your clinic?
They see me or they see someone else for manual therapy and they don't feel better. Maybe they feel better in the moment, but they feel worse after. Sometimes they feel really good on the table or whatever they're doing, massage, acupuncture, whatever it is. They get off the table and they're like, what did you do to me? Like, I feel worse. I feel like I got hit by a truck, right? And that's a sign that we might be a little bit more in that chronic brain-based pain because we've kind of exceeded their metabolic capacity and we are actually stressing their nervous system out more, right? That's not something we ever intend to do. But when we have manual therapy as one of the main tools in our toolbox, that's what we always want to apply, right? We're chasing the pain, we're attacking the area that's painful. And that can actually be doing your patients maybe less good than we want to. And of course, it's never intentional, but we recognize those signs when it happens the first time. We don't have to keep putting our patients through that. We can shift to more of a brain-based approach and get our patients better for the long term.
So for those listening, like this is what Becca's going to go deeper into in her summit presentation. But high level, Becca, when we're talking about you're like, okay, we might have to shift our approach. A high level, what does that mean?
That's a great question. And that's what patients are always asking me. Like, okay, great. Love a brain-based approach. What do we actually do? Right.
Yeah.
And so we are going to dive deeper into the practical exercises and things that you can start integrating in your practice tomorrow in that summit presentation. But just 10,000 foot overview, right? When we have chronic pain, we know that sensory system, that map that our brain has of our body in space gets a little bit blurry and it gets reorganized. And unfortunately, that's just a product of chronic pain. But a goal of my therapies for my chronic pain patients is to decrease that, reorganization, help that map get a little bit sharper, more clearer, so that if we touch you here, you don't feel it all over or you don't feel pain, right? We're able to localize it. And then eventually, right, there's no actual tissue damage necessarily in chronic pain. So we're able to kind of get rid of it more long-term by kind of sharpening those maps. We do a ton of sensory modalities, kind of motor modalities too, but maybe not initially, right? If they have a lot of pain, I'm not going to go make you do burpees or push-ups or movements that would exacerbate your pain. We're going to start with that sensory system, remapping and reorganizing that, and then we'll get more into building function at that point.
Amazing. And just so you guys know, Becca's presentation is all on this and going deeper in that. And then her bonus for the summit is basically a workbook on how to exercise with, like, how you actually begin exercise again when this is something you're being challenged with. So for the clinicians listening, it's going to be a beautiful guide for you. For those clients and those on a healing journey that are listening, it's going to be a beautiful guide for you. I love this. I'm really excited to see what you pulled together. Becca and I just nerded out on a conversation beforehand about all of this and some directions on where I want to take things when I was saying, like, I'm deep diving hard this year on somatic experiencing and trauma-based stuff and all this element. And I think I don't fall into one camp of we just do one thing or the other. I think there's a value in the mind-body work. I think there's value in obviously in the movement we do. I think there's value in all these pieces. And so I'm looking at, after I do this ridiculous amount of program that's coming up, how I can blend and take these pieces and bring it together really to work. And for me, always, it's how do we better serve our clients and providing that holistic, collaborative approach on healing. Because it's like we always talk about, if you are on a persistent journey and you've been on a persistent journey for years, it's not just one thing.
Yeah, that's so true. And some of the research is showing that something that predisposes patients to chronic pain is trauma and different childhood experiences, right? There's nothing that necessarily predicts one-to-one if you will or will not get chronic pain, but that is one of the risk factors that they're finding. And so it's not one thing. And if we just attack it from a body or brain-based approach and we're not dealing with some of those underlying emotions or traumas, we might not get full resolution because there's a little bit more going on.
Yeah. No, I love it. Becca, I am so darn proud of you and all the work you're doing and your clinic and the changes you're seeing with your patients. It is so exciting for me to sit back and just watch.
Oh, thank you so much.
Yeah.
I'm so glad that you've been part of my whole journey, right? You're a big piece. And I send patients your way all the time. Like, go check out Natasha. She's such a bright light in the concussion space because so many of my patients come in feeling really defeated. I'm like, there are good people out there. You just have to find them.
And it's so true. And I think that's another piece what I love about this summit is because I think sometimes clinicians can get jaded when it's like, they can get jaded or they feel super stuck and they feel like they're the only ones that are stuck. And they're like, do I even know what I'm doing anymore? And then you have clients who have seen 10, 20, 30, 40 people, have been told that this is all in their head, have been told they just have to live with this. And their light is snuffed out. And I think one of the most beautiful moments of the summit last year that I loved is because the whole point is we bring everyone together at the summit. And at the beginning of the summit, we're like, who are the clinicians in the space? And then we're like, who are those on a healing journey? And I remember last year, I just sat there and I stepped back and I said to everyone, I said, look around you. I said, clinicians, raise your hands. So I had everyone turn on their cameras. And I was like, clinician, raise your hands. And so the clinicians' hands went up. And I said, to those of you on a healing journey, look at this. I need you to see that there's amazing people out here who want to help you and they want to learn. And I said to the clinicians, look around you. These are other people here who share your passion, who might feel that they get stuck at some points too, who are here to learn just like you. And then I'd enter those on a healing journey and then I have them raise their hand and be like, to the clinicians, these are people who need you. These are people who are actively want to be engaged in their health and their healing and their recovery, and they're seeking people like you out. And so it was a really cool moment that obviously was completely unplanned because I don't plan stuff like that. It just comes out of my mouth. But it was this really cool moment to have because there's not very many spaces where we all come together as a group like that. And so it was a cool moment. So clearly we'll do something similar again this year.
I got chills when you were saying that. It is so true because we do get jaded and we get frustrated when our patients aren't getting better. But if you stay open, like you can learn. And like we say, they're out there. I know they're hard to find, but look at Natasha's Summit because all the people that are there are the people that we're talking about, right? These are the people that have got your back and want to learn and know what they're talking about, and they're going to do right by you.
Yeah. Oh, so excited. For those that want to follow Becca, so she's got an awesome Instagram. Her links are below. But Becca, what is your handle?
Yeah, my Instagram is Clarity Brain and Body Clinic on Instagram, and my link tree has everything linking to my website and contact information if you want to reach out. I'm such an open door for both patients and clinicians. If you want to reach out, come shadow, come pick my brain. You're absolutely welcome to.
I love it. Well, we will see you on the summit in a couple weeks, which is crazy. I'm just like, oh my gosh, it's so soon. And for everyone listening, grab your tickets if you haven't already. And until next week, we will see you soon. That's today's episode. Thank you so much for tuning in. If you liked what you heard, give us a like, give us a share, give us a tag on Instagram, and please never hesitate to reach out. We love communicating and connecting with you. Until next week, my friends, have a marvelous day.